Right, in good health. We told you at 5 that poison ivy is what's going around a lot of doctors' offices. Well, doctors say most of their patients had no idea they were tangling with poison ivy until it was too late.
The saying goes, leaves of 3, let it be. But poison ivy can be tough to see. It can hide in the brush and even grow up on trees. Sometimes it can take a while for a poison ivy rash to develop, but when it does,
for poison ivy, it's terribly itchy. It's that itch. And people, once you've had it once, you know when you get it again. It's that terrible, unmistakable itch.
Cleveland Clinic dermatologist Melissa Peleong says the first time you're exposed to poison ivy, you might not get a rash. But if you're exposed again, you likely will. And it gets worse each time you come in contact with it. The rash tends to show up first in places where your skin is thinner, like the eyelids. The resin or oil on the leaves and stems of poison ivy is what causes the reaction. Some people are more sensitive to the effects than others. Prevention, though, is key. If you're going to be in a wooded area, wear long sleeves and pants and use gloves to clear out brush in your landscaping.
When you get home, really before you even go very far in your house, strip all those clothes off, put them in the wash them in hot soapy water, throw them in your dryer, and you should get in the shower. Start with cold water. Cold water will rinse the oil off. Hot water lets it spread more. So rinse with cool water, and then you can use soap and water and rinse the rest off.
And if you develop a small poison ivy rash, doctors recommend using over-the-counter hydrocortisone ointment, putting a cool compress on the affected area, or taking an antihistamine. If the rash covers a large part of your body, or if you develop a fever or other concerning symptoms, you should seek medical attention immediately.
Well, man, if you have booked a family